So as everyone knows, the cardiovascular outcomes of empagliflozin were surprising to all of us, as we just mentioned. We did not expect it. It was a non-inferiority trial. We did not expect to see such a dramatic improvement in macrovascular complications. Another complication that may have been predicted to be reduced was the microvascular complication of CKD. And as you know, that progression of CKD was reduced by 39% with empagliflozin, as we already have reported. One of the microvascular complications that were tracked, but solely on the basis of investigative reports, in other words, we did not do periodic retinal exams, just on the reports when patients came into the study site, was retinopathy. And this is becoming an interesting area in glucose-lowering medications because, as you may know, two of the GLP-1 receptor agonists have at least a suggestion of potential detriment in terms of the retina. Now, most of us feel that that is not a direct effect of the medication, that at least with semaglutide that had a statistically significant increase in retinopathy may be simply on the basis of a prominent drop in hemoglobin A1C, as has been reported many years ago with rapid reductions in glycemic control in patients with type 1 diabetes. But because of that controversy, we took the opportunity to look at our retinopathy data. And as you know, the EMPA-REG outcome trial involved 7,000 patients. They all had prevalent cardiovascular disease. About 22% of the patients actually had baseline retinopathy by report, and 32% had CKD defined as either macroalbuminuria or a GFR under 60. So it was a reasonable prevalence of these microvascular complications at baseline. Now, part of the predefined microvascular composite was, as you'll see here, incident or worsening retinopathy, which we have already reported, which was reduced by 39%, plus three retinopathy complications, one being the initiation of laser therapy for diabetic retinopathy, the second being the presence of vitreous hemorrhage, and the third being diabetes-related blindness, and there were very few events for blindness. But when that composite was accumulated, both the nephropathy as well as the retinopathy, the composite microvascular outcome was reduced by 38%. But most of the events were with nephropathy, so that was driving this complication. You can see that the point estimates for the two major retinopathy complications were to the left of unity, so there did not seem to be any trend toward increases in retinopathy in this population. This is now post hoc because what we determined was the events that were described as the administration of an intravitreal agent, which is now being used, as you know, for macular edema and various types of retinopathy. These are typically anti-VEGF compounds. So we, again, post hoc, we developed this retinopathy composite, which is, again, the initiation of photocoagulation, vitreous hemorrhage, diabetes-related blindness, but now with the component of the administration of the intravitreal agent. And you can see that that component has a hazard ratio of 0.78, and the confidence intervals cross 1, so this is not statistically significant, but there is no evidence of harm from empagliflozin in terms of retinopathy. This is the Kaplan-Meier curve for this retinopathy composite, and you can see that the curves begin to diverge at about 18 months, but again, not statistically significant, but no evidence of harm. And finally, what we did was take patients that had greater or lesser hemoglobin A1C reductions, because again, that's the theory as to why in SUSTAIN 6 there had been this increase in retinopathy because of the prominent drop of A1C in that study. And here in this upper right panel, the top dot here with a hazard ratio of 0.87 were individuals that had a lesser than 1% drop in hemoglobin A1C. And the bottom dot here with the hazard ratio of 0.41 were individuals who had a greater than 1% drop in hemoglobin A1C. No statistical interaction between those two subgroups above and below hemoglobin A1C change of 1%. So what we concluded is that there's no evidence of retinopathy harm in the EMPA-REG outcome trial. there are some interesting trends. One could theorize that over time there may be a reduction in retinopathy, whether it's related to improvement in glucose control or some direct effect of SGLT2 inhibition. Thank you very much.